I'll be doing a very brief presentation of my most recent publication, which couples up as the project that I did for my master's. And I'll try to simplify it. I know it's quite intensive, but I'll make it short. So I was working on a certain plant called Launaea cornuta. And so I was checking for the cognitive enhancing activity. I was also checking for the phytoconstituents of that plant. And I was also checking for the anti-lipid peroxidation of the plant, which was a combined project. So we can go to the next slide. So we all know that cognitive impairment is one of the issues when it comes to the elderly. Once you get to your 60th year, you know that you may get dementia and many other conditions. And so that was the validation of doing the project, because we wanted to see if this plant can be able to boost memory or if it can actually enhance cognition, because we know that in those neurodegenerative disorders, the patients have limited knowledge, reasoning, awareness, and also judgment, which is very strenuous even to the family members, because once a patient has some of these conditions, what happens is that they start forgetting the people around them. So another thing we can note about cognitive impairment is that most of the cognitive impairment-related conditions are usually very connected to oxidative stress. And oxidative stress usually comes up when reactive oxygen species attack the lipid layer of the brain. So that is something to note, because we will mention it at a later point. So this plant, Launaea cornuta, it is a plant most of us have interacted with, only that maybe we never knew the biological name. It's a very small herb, also known as a bitter lettuce. In Swahili, it's called mchunga. In Kikuyu, Embu, and Meru, it's called modhonga. In Luo, it's called achok. Yes, and so other than what I was working on, this plant is used in the Embu community to treat joint pains, warts, diabetes, swollen testicles, high blood pressure, and also diabetes. So this is the plant. I guess most of you have seen it, maybe as a weed, and other people also call it chakula ya sungura, but others eat it as a vegetable. Yes, so it's a plant we've really interacted with, only that maybe we didn't know its beneficial properties. So my objectives were very simple and straight to the point. The first thing, I wanted to identify the phytoconstituents in the plant. The second thing, I wanted to determine the ability of that plant to deal with cognitive issue, or just to enhance cognitive activity, and also to determine its toxicity levels. So for every objective, I did different methods. So the first thing was to collect the plant. I got it from Irangi Forest in Embu County. And then I extracted it. Then I started working on the assays. For the cognitive enhancement activity, I used the Morris water maze, which I will explain a little bit after this. Then for the acute oral toxicity, I used the up and down procedure, which is as per the OCD guidelines. And then now I did the phytochemical screening as indicated by Habon. I believe all of us studied this in the Trees and Evans books, so I just did a replication of the same. So after doing the Morris, after doing the Morris water maze experiment, I deducted all the brains from the mice, and then I did a T-buzz assay to identify the levels of the malonaldehyde in the brains, so that I get to understand the anti-lipid properties of the of the extract. Then I analyzed the data using some of the statistical tools available, but mostly I used an app or a software called Enemies, which is mostly used for these procedures. So ideally, we are supposed to have a Morris water maze. But currently in Kenya, there is no one with it. So we had to come up with something that looks like the maze. So I looked for the people who had done a project similar to mine, and I got some advice from them. And actually, this is what they have been using. So they just gave me their maze to use, which I returned after the project. So maybe just to explain a little bit on what exactly was happening. Okay, from the observation, this is just a tank, and then that pink thing is a small manila paper, which is a marker for the mice to remind them, and I'll explain how. This thing that looks like the drainage is slightly above the water. So the concept was to introduce the mice to the maze, and then the mice were supposed to look for that escape route. So what happened, I trained the mice for 3 days. So the first day, when I put the mice in the water, they would just swim around and try to figure out the new environment. But now with time, especially now by the third day, they had already known that there is a maze, there is a pink paper, and there is an escape route. So what would happen, the mice would take less time to get to the escape route. And that was the essence of the whole project. So the results. On the phytoconstituents, most of them were present, except the tannins and the anthraquinones. However, someone else has done this project, has done the phytochemistry of this specific plant, but they found out that their plant had tannins and anthraquinones. However, this plant grows in different areas of East Africa. So that could explain why my plant from Embu County did not have those constituents, but for the other people had all the constituents. So I'll summarize this. This is the results of the acute oral toxicity. As I mentioned earlier, I just used the OECD guidelines. And for you to do that acute oral toxicity test, you're just checking for the LD50 of your plant. So according to the guidelines, you're supposed to subject the mice to a dosage of your extract at 175 mg per kg, 550 and 2000. And then you observe the mice after 1 hour, after 6 hours, after 12 hours, after 24 hours, after 48 hours, and then after 14 days. So you're supposed to check for some of just the physical appearance of the mice, the fur, the activity, the mucous membrane, the color of the urine. And as per my project, this plant did not cause any toxic effect. So from that analysis, which we can see here, that there was nothing, the mice were not salivating, they were not sleeping. So after the project, I said that this plant, according to the OECD guidelines, it has no surmountable toxic effects. So after doing that Morris water maze activity, I was able to identify that the mice that had been treated using my extract at the dosage of 50, 100, and 200 had improved cognition after subjecting them to the maze. And that was measured through the escape latency and the navigation distance. Earlier, I explained that the concept was to find out whether the mice would, number one, be able to remember that there was an escape route, and the second thing, how much time it used to get to the escape route, and the third thing, how it got to the escape route. So some, which were very intelligent, would just go direct to the escape route. Others would go round. But what to note from this whole process is that those that I had given my extract took a shorter time, took a lesser navigation distance, and their escape latency was high. So after doing all that analysis, I found out that the extract actually has some cognitive enhancement activity. So after doing the anti-lipid peroxidation test, which I used the TBAS assay, the point was to look at the levels of malondialdehyde, which is the marker for the level of oxidative stress on the brain. So from the brain of the mice that had been given the extract, the MDA levels were low, meaning that this plant extract is able to give anti-lipid peroxidation activity, or in simpler terms, it has antioxidative properties. So discussion and conclusion is that the plant extract does not cause any toxicity. The second thing, as mentioned earlier, is that it enhances cognition, and it also reduces the lipid peroxidation of the brain, and it also has some phytochemicals, as I have shown you earlier on the table, which are of great pharmacological value. So the conclusion would be that I would aim to specify the amalgams in that product, and also just to do more intense toxicity profiles, because everything I was doing was just basic. And so I would look forward to actually do a more intense work on the extract now that it has some pharmacological potential. Yes, so those are some of the references. I'd like to, some of the references. And you can actually check the publication online. It's on Science Direct, Elsevier, and many other journals. So you can just check it out if you are more interested. So I'd like to acknowledge the University of Nairobi, Mount Kenya University, KUTRRH, and KEMRI, because those are the people I worked with to attain or to finish up this project. Thank you so much.